In this seminar, we're going to deal with the difficult topic of dealing with embarrassing situations or topics to bring up with a patient. We're going to identify the issue. What is the issue? Then we're going to look at some cultural elements to that. We're going to just recap on what it means to be professional and keeping professionalism. And then we're going to specifically look at the example of consultation skills in taking a sexual history. But the principles of this remain with other topics that we highlight at the beginning. So, topics that may be embarrassing culturally and particularly between the sexes. So I think for male doctors, particularly in this culture, asking female patients about their periods, vaginal symptoms, and taking a sexual history is quite a difficult and embarrassing subject, potentially. Either female or male doctors inquiring about erectile function in males, if there's any dysfunction, this can be quite embarrassing to ask about. Again, asking about anal symptoms, and then inappropriate behavior or over-familiarity. So the patient is over-familiar, or even the doctor is. Hopefully that's not the case, but a patient may become over-familiar, maybe an inappropriate eye contact or touch, or revealing personal details inappropriately more than is required. So I'm just going to recap quickly on what is professionalism. Well, professionalism is a collection, it's a set of values, behaviors and relationships that underpins the trust the public has in doctors. So the public has expectations of doctors, and here are some of the points of their expectations. They want their doctors to be experts. That means that they're competent in knowing their field, and they are practiced in their skills and are competent in that too. That they keep high standards, they keep up to date, they're aware of the current medical knowledge in their field, and they maintain high standards when consulting their patients. Doctors should keep respectability, their personal appearance, dress, and the way they interact with others, keeping respect in the consultation. Responsibility and reliability talks about timekeeping. The doctor's on time, arrives on the clinic on time, keeps to task during the clinic, keeps good timekeeping and completes any tasks that may arise from the consultations, whether that's another referral, listing somebody for an operation, organizing some tests, whatever tasks that may have arisen from the clinic. Probity is about honesty. It's about upright and right behavior. It's about goodness, really. That the doctor values and behaviors are good and honest in everything that he does, whether that's financial, whether that be in his interactions with patients or with the higher authorities, whoever that may be with. And that also goes with conduct. That there's nothing hidden. Everything's open, again, with financial dealings, with any interactions with the patient, everything is open. And like we said earlier, respect for the patient, being courteous in manner, maintaining the patient dignity, particularly in examinations, in surgery, whatever that may be, and obeying the law of the land. Making sure that the doctor doesn't break the law in whatever practice they practice, and also respect includes confidentiality. The doctor will maintain confidentiality of the patient. What's said in the consultation room remains in the consultation room, again with privacy that the patient's needs are met in terms of examinations. A chaperone may be offered, making sure the room is a private location, where others may not come in. So the context of professionalism is really what we're going to be looking at in the terms of taking a sexual history. Remember, you're going to be a professional. You are becoming a professional. What does professionalism mean then? So being a professional means that you almost keep a facade, a masquerade, and that you don't pass on any judgment. And when you ask questions, particularly when asking about sexual history, you don't ask any questions that are judgmental. You keep your questions matter of fact, in a way that is just routine. When sensitive information is disclosed, that you keep patient confidentiality. That is part of the golden rule of the doctor-patient relationship. All the information that the patient gives you is confidential, unless, with the consent of the patient, you need to share that information with another health professional involved in their care. Also, when we're asking questions, it's important to maintain a professional manner, showing respect and dignity to the patient, and allowing them to answer the questions, and also allowing them to refuse to answer those questions too. Explaining why you're asking those questions is very important. So being a professional is a bit like an act, like I was saying at the beginning, where you hide your own judgments, emotions, and feelings, whatever you may be thinking, whatever you may feel about this patient's practice, whatever you may feel about that, you hide those emotions as a professional and pass no judgment on the patient. But what about the elephant in the room, as the saying goes? Often, patients may not feel comfortable talking about their sexual history, or their sexual partners, or their sexual practices. And in a more conservative Islamic society, as it is in Jordan, these topics may be taboo to discuss to strangers, even amongst family. So doctors themselves who come from the culture may be embarrassed to ask these personal questions. It's just not something that you normally do. It's very foreign, and it feels maybe a little bit haram. This is not honourable thing to ask about. However, obtaining a sexual history is very important, particularly when we're thinking about sexually transmitted infections, risk factors, and maybe having to do contact tracing where there is an infection, that kind of thing. So how do you introduce the topic? People talk about a warning shots before going into something that's sensitive. So you may start off with a bit of background explanation. I'm going to ask you a few questions about your sexual health and practices. I understand that these questions are very personal. That's a bit of a warning, but they are important for your overall health. So it's important I understand these things and I can make a good assessment. So then ask their permission. Are you okay if I proceed? Make sure they're on board with you. Do you have any questions before I ask these questions? Or is that okay with you? So get their permission. Normalizing is a big aspect of framing these questions. So it's just part of the normal routine medical interview, particularly in certain skin dermatological problems, particularly around the genitalia or vaginal symptoms or penile symptoms as well that a patient may present with. So as part of the history, I need to ask you, or just so you know, I ask these questions to all my adult patients, regardless of age, gender, or marital status. So they're just normalizing it. Talk about framing the topic, a question, the reason why you're going to ask this question. So because of your vaginal discharge you describe, I need to ask you some more questions to know how best to help you. Is that okay? And then the idea of just building trust and promising to keep confidentiality. Like the rest of your information, this information is kept in strict confidence. It will not leave this room, but it's important that I know these things, that I know about how best to help you. So specific questions in asking a sexual history. asked in a matter of fact and non-judgmental way. Do you have a regular sexual partner at the moment? Is your partner male or female? Can I ask if you had any other sexual partners in the last 12 months? Again, risk factors for sexually transmitted infections. How many were male? How many were female? Do you use barrier contraception such as condoms? Sometimes, always, or never? Have you been at risk of unprotected intercourse, basically? Particularly ask this if they've had more than one partner in the last 12 months. And then you want to know what kind of sexual contact they've had. So can I ask you what kind of sexual contact you've had? Is that genital, anal, or oral? Again, higher risk sexual practice like anal sex is increased risk of HIV, for example. Oral, if you think about herpes simplex being passed on. Have you ever had a sexually transmitted infection? When? How was it treated? And recurrence of those symptoms? And ask specific about HIV testing. So that's the range of questions as laid out in McLeod's. And I think it's, just really practicing these, making it sound natural. Maybe you might phrase them slightly differently, but just keeping it matter of fact and non-judgmental in your tone is the key. So resources, there's McLeod's we've mentioned, but also there's a website there taking a sexual history and what it should contain and some reasons why. I hope that was helpful.